Hi everyone, I'm Helen. I'm the second-year resident in North Alabama Medical Center Internal Medicine program, and this is Mina. She's our wonderful first-year resident. So today we're going to briefly talk to you about the ambulatory care. So ambulatory care in our program is a cornerstone of a program because we're an internal medicine program. So usually those patients are the patients that we admit in the hospital and taken care by our medical team on the floor, and then was discharged from the hospital, and we follow up with those patients in our clinic. So this is a continuity clinic, and which is, I think, it's very necessary because we want to make sure that the patient care doesn't fall into a gap. A lot of like an older patient, they have a lot of medications. When we discharge them, they sometimes don't know how to manage it, and we want to make sure they will be taking the medications that we prescribed. And we have other problems like sometimes we discharge patients on Lasix, but we want to monitor their renal functions and then make the continuity very necessary. So every resident, we usually scheduled for the clinic once a week. And then we also have a whole month of a clinic during the year. So we are precepted and supervised by a panel of general practice physicians. They're very dedicated. I think that's one of the part that I like most about the clinic is we have a curriculum developed based on our practice in the clinic. And the different preceptors, they bring in different perspective of medicine. But our practice in the clinic is not without any challenges.
One of which was, as we all know, the COVID. It did bring its unique set of problems, and especially because a lot of patients don't want to come into the clinic for non-emergent issues. So typically, if they're not, almost at a position when they want to call 911, they don't want to show up at the clinic. It has its advantages being that there are other specialty practices in there. So we have increased foot traffic, and as such, we can get some patronage from there. Also, some other ways that we're trying to work with the challenges that we have include we would schedule patients from the hospital for their 1 week or 2 week follow-up immediately prior to discharge, just so that they don't go home and start wondering how they will get to the clinic. So that's another way we want to address the issues. So the discharge planning would be very pivotal to increasing patronage in the clinic, in the ambulatory clinic, and will also serve to improve the health outcomes in the community, because if patients are being followed up more closely in terms of primary care, then obviously health outcomes will improve and we will get a better provider-patient relationship. And the clinic is the best setting because they're not like in acute distress. They're just coming in for possibly a follow-up or maybe a concern that they have. So when you build that relationship, you look in their eyes, and that moment they trust you, and you can foster a relationship going forward in terms of bettering their health outcomes, bettering outcomes of the community and of the family unit. So we invite you to come and experience IM Residency Continuity Clinic as we know and love it, practicing healthcare the ambulatory way.